Hi guys, welcome back to my channel. If this is your first time here, welcome. Please don't make it your last. Kindly hit the subscribe button and turn on the notification bell so you'll be the first to get notified whenever I drop a new video. And if you are a returning subscriber, welcome back to the channel. So in today's video, I want to talk about vaginal discharge, the meaning, the cause, and possible treatment. So if that sounds like what you want to know, keep on watching. You all know vaginal discharge to be like when your vagina brings out another thing aside your normal blood flow and urine. So vaginal discharge is very common among ladies, and it happens to ladies at any age, but especially after your puberty stage. It varies in amount, consistency, odor, volume, and it also depends on the stage you are. Maybe you're pregnant, maybe you're breastfeeding, maybe you have infection, it might be after intercourse or any other thing. So I'll be talking about the type of the discharge and the disease that comes with it. Yeah, the first one is yellow-green discharge. This is not normal because it is characterized under the symptoms of sexually transmitted infection, especially Trichomoniasis vaginalis. Like Trichomoniasis vaginalis is a parasite that causes trichosoma infection, and trichosoma infection is one you can get from your partner. This is accompanied by a frosty yellowish discharge. It is caused when you have unprotected sex with someone who has trichomoniasis, like who is a carrier of trichomoniasis. Some women do not notice any kind of symptoms, but like I said earlier, it comes along with a frosty greenish yellowish discharge. The treatment is antibiotics. Like you have to use antibiotics, and you have to give to your partner or the one you have sex with at least like 3 weeks or 4 weeks back. Now during this treatment, you should stay away from sex for at least a week. The second one is gonorrhea. When you have gonorrhea, you tend to notice this greenish yellowish discharge. This bacteria can affect the entrance of the womb, the urethra, and also rectum, mouth, and also nose. It is contacted by having unprotected sex with someone who has gonorrhea, and sadly it can be transferred from a pregnant woman to the baby. It can also be contacted through sharing of sex toys. Yeah, that's very wild and crazy though, but people who share sex toys, like this gonorrhea is very common. When you share sex toys, you can easily get contacted. It is asymptomatic because like most women do not even notice anything. It does not give any symptoms, but the greenish yellowish discharge is something you should just take into consideration. The second type of discharge is pink or red discharge. It can be normal and it can also be abnormal depending on the circumstance. If it is some days to your menstrual days, like your menstruation, it is normal. That's just to notify you that the menstruation is around the corner. But if you notice a deep pink discharge during your menses, that means there is slow flow of blood out of your body, and a particular amount of blood is staying too long in your body for it to come out. So it will change in the color, and that let me say that makes it abnormal. But the normal one is just when you're about to see your menstruation and just notice a pink or a red discharge. It's just to notify you that the menstruation is around the corner. Then the second one is the post-coital bleeding. This can happen maybe like 30 minutes to 24 hours, the first 20 minutes to 24 hours after sex, and it can be as a result of a little cut in your vagina or infection. Like people who have infection, sometimes when there's a video I'm going to make about genital wart. Like some people, when they have sex, they experience bleeding after sex. So postcoital bleeding can be as a result of this, and can be as a result of little tear in your vagina during sexual intercourse. This little tear can be as a result of not enough lubrication. Like when you are not well lubricated during intercourse, all this tearing out, it's just like tearing and wearing of your body when there is not enough lubrication. It can be as a result of pregnancy. Now, if you are expecting your period and you have unprotected sex during that time, and you notice a pink or red discharge during that time you're supposed to have your menstruation, it can be as a result of pregnancy. Now, it is advisable to see the doctor now when you notice in the early stage, or else you are going to wait for another 9 months before seeing your menstruation. Red or pink discharge can be as a result of miscarriage, like we all know miscarriage. Yeah, and it can be as a result of menopause. Menopause is when you get to a particular stage in your life as a female and you can't reproduce again, like you stop menstruating, like you can't just reproduce again. And when you notice this red or pink discharge during this stage, it's of best opinion to see your doctor, because it can be as a result of endometrial cancer. Creamy or white discharge, it is likely to be thrush. Thrush is a yeast infection that is caused by Candida albicans. Then the symptoms you are going to notice is itchiness, like creamy or white discharge from your vagina. The lips of the vagina will be swollen and it will be red. This type of discharge is as a result of excessive intake of antibiotics. It's as a result of using foods as lubricants. You know, I mentioned it in my previous video. I'm going to leave the link right here. I mentioned it in my previous video when I talked about the things you should not, I think the things you should not do also. I'm going to leave the link right here when I talked about people who use foods as lubricants, like especially yogurt. Yogurt contains this, and overgrowth of this thing can lead to yeast infection that can come down with having thrush. So this period, when you notice any symptoms like creamy or white discharge accompanied by itchiness, reddishness, and I think swollen vagina or swollen vulva, it is likely to be thrush. You can overlook it if that is your normal vaginal discharge, because we have some people who their normal vaginal discharge is whitish in color or cream in color. Antifungal is used for this treatment, which can come in form of pastries and can come in form of creams. Like those pastries are all these drugs that they'll tell you to use applicator to pull it into your vagina. And using this, I would really advise, when this is prescribed to you, the best way to administer is to wash your hands. Like when you want to sleep, after urinating, wash your hands, then use the applicator, because most times people will wash their hand and they'll still touch the applicator with that dirty ends. Microorganism can be on your palms, and when you touch it, you're still transferring that microorganism to the applicator. The microorganism will be transferred to the drugs and putting it back into your vagina. That means the microorganism are going back into your vagina, so you have to take caution. Okay, yeah. Gray discharge. This type of discharge can get it when you are infected with bacterial vaginosis. Bacterial vaginosis is not a sexually transmitted infection, but it increases your risk of coming down with any of getting any sexually transmitted infection. And bacterial vaginosis is a condition when the pH of the vagina has been altered, and this often happens when you use vaginal sprays, all this feminine wash, when you wash your vagina with soaps, when you apply perfumes and all these things. It's often accompanied with a very offensive odor after your shower, and also a fishy smell. It can cause overgrowth of some certain type of bacteria. Clear discharge, this is the normal discharge of your vagina. Then it depends on the stage you are. Maybe you are breastfeeding, ovulating, or you're sexually aroused, then the volume will be different. It doesn't need any treatment and is not accompanied by any itchiness or discomfort. Now the prevention. To reduce all this unwanted vaginal discharge, you have to practice personal hygiene. Like you have to wash your panties, you have to just practice personal hygiene. You have to just clean her. Don't say because you want to clean your vagina you should now start douching, or you should now start washing your vagina with soap and water. No. Also practice protected sexual intercourse. Yeah, make sure you make use of condoms anytime you want to have sex. Wear cotton underwear. I can't say this. Like, I have a video I mentioned that, and the rationale behind that, I'm going to leave the link right here. Like the reason why you should wear a cotton and not a synthetic underwear. Also, see your gynecologist. Anytime you use the ladies, make sure you wash from the front to the back, not from the back to the front. This is because, you know, the vagina is a very very delicate area compared to your anus. Now, the bacteria from the anus, you are bringing it to the front when you wash from the back to the front. That's that about this video. I hope you all enjoy. Please let me know your thoughts in the comment section. Follow me on all my social media accounts. The links are in the description box. Share, like, comment, and subscribe. See you in my next one. Stay blessed and stay fabulous.